We are joined now by Dr. Ashish Jha, Dean of Brown University School of Public Health. It's always good to see you, Dr. Jha. I want to focus on what appeared to be good news about the schools. It doesn't seem at this point that they are the super spreaders that people thought they could be. Do you feel that too? Are you more optimistic that schools can reopen safely?
Yeah, good morning, Gail. Thanks for having me on. I am more optimistic. I think we are learning as schools are opening, especially the younger grades under K through 5 look pretty safe in most communities. Older high school, I think you still have to be a bit more careful. Mask wearing, some level of testing would be helpful everywhere. But I'm becoming more optimistic that we've got to try to get kids back in school.
Yeah, I've heard you say there's a high cost of keeping kids learning remotely. What is that cost?
Yeah, the cost of keeping kids learning remotely is really quite substantial. We know it widens achievement gaps. We know it's causing a lot of mental health issues for kids. Kids are not born to be zooming into class all day, every day.
Yeah.
It's one thing to do it for a few days, but to do it for an extended period of time is really harmful.
Yeah, but we keep hearing COVID cases on the rise again in 37 states. What can we do? What should we be doing to stop the spread? Dr. Fauci says, if we're not careful, we're going to have a very rough winter and another big outbreak. What to do, Dr. Jha?
Yeah, Dr. Fauci's right. So here are the things, right? First of all, everybody's got to be wearing masks when they're outside their home. This
How
is
many
not
times
that hard.
can we say
People
that, Dr. Jha? How many friggin' times can we say, wear your mask? I'm serious.
A lot of, I know, and a lot of folks are still not doing it.
Exactly.
And I'm saying, please do it so we can get kids back in.
Yes.
I really think bars and a lot of indoor dining is very risky. A lot of people are starting to have house parties and gatherings. Look, your home doesn't make you immune to the virus. So being careful, being thoughtful, it's how we get through this pandemic.
We talk about wearing masks. The president is back on the road. He's in Florida. They said they passed out masks, but people weren't wearing them. I don't know what good that does if you're not going to wear the mask. He says that he is immune and that he feels powerful. Is this the message to send at this particular time? And let's talk about immunity, what that really means.
Yeah, Gail, I think, unfortunately, it is not the right message. First of all, we don't know if the president is immune. We are seeing some number of reinfections. Thankfully, not very many, but some people are getting reinfected. And second, he's the president of the United States. He should be sending a very clear symbol and signal to the American people about the importance of wearing masks. He's not doing that, and that is really unfortunate.
Also, as the president of the United States, he's getting a different type of treatment, too. Listen, as it should be. As president of the United States, he should get the best possible treatment that is available in the world. So no one is faulting that. But he is getting a different kind of treatment than most people get. True?
Absolutely. I mean, the Regeneron therapy, the antibody therapy he got, that's not accessible to most people. Obviously, world-class care at Walter Reed. The president got great care, and I think that's right. But the point is, most Americans can't get that.
He says that the President Trump's doctor said he's no longer infectious. He tested negative for consecutive days using an antigen test. Is that good enough? The antigen
this is
test.
Unfortunate and it's confusing. Yeah, Gail, this is confusing because the antigen test is not good enough. It's not what it was designed for. Dr. Connolly knows that. My sense, my guess, we don't know because they haven't been clear, is that he's still PCR positive. It's entirely possible the president is no longer infectious, but we'd like to get the full information, and the antigen test doesn't get us there.
All right. And one more time, should I wear a mask or not wear a mask? I'm confused.
Gail, please wear a mask. It's good for you. It's good for everybody else.
Message received, Dr. Ashish Jha. Thank you very much.